अऊज़ुबिल्लाहिमिनश्शैतानिर्रजीम बिस्मिल्लाहिर्रहमानिर्रहीम अर्रहमान अल्लमल कुरान खलकल इंसान अल्लमहुल बयान। हमेशा की तरह शुरू करने से पहले स्टार्ट विद द गुड थिंग। रिमेंबर, ambition is the path to success. However, persistence is the vehicle you arrive in. So be persistent, do a small little study but daily. So today the topic of our theory examination or theory topic is achondroplasia. This is important theoretically as well as you come across many patients in your practice. So, a few things, it's an autosomal dominant disorder and it is due to the defect in fibroblast growth factor receptor 3 gene. It's most common bone dysplasia. Remember that. Now there are few terminologies which you need to understand. Rhizomelic shortening. It's the shortened limbs that are proximally shortened, such as the small humeri and femora. Brachydactyly, they are the short digits. Kyphosis is a gibbous, convex, or protuberant deformity in the mid thoracic to lumbar region. Lordosis is the concave deformity of the lumbosacral region. Saddle nose deformity is a flattening of the nasal bridge in association with mid-pace hypoplasia. Chondrocytes are cells in charge of initiating extracellular cartilage matrix development that will further lead to the ossification of long bones, spine, and medial aspect of the clavicle. Various knee deformities are the deformities of the knee with outward deviation due to bowing and or joint laxity. Cervicomedullary compression, narrowing in the upper spine secondary to tightening of foramen magna. So symptoms, the patient can present with a short stature noticed after birth or early infancy. The parents, when the child is born, the parents see it has a very disproportionate short limbs, especially upper limbs, arms and thighs. The baby will have large head size, macrocephaly with frontal bossing. On development, the baby may present with a delayed milestones that are motor delayed milestones. There will be gait abnormalities such as a waddling gait. There will be recurrent ear infections due to eustachian tube dysfunction, sleep apnea or snoring due to mid-face hyperplasia or airway obstruction. So in history, there will be the family history of short stature or skeletal dysplasia. The parental consanguinity, though most cases are sporadic. There will be pregnancy history, there will be decreased fetal movements or polyhydramnios, which is rare. The developmental milestones, especially motor, will be delayed. There will be breathing issues or snoring, and there will be feeding difficulties in infancy, hearing issues or recurrent ear infections. So, examination or signs, the child may appear with a short stature with rhizomelic, short limbing. There will be trident hands configuration, separation between the middle and ring fingers, macrocephaly with frontal bossing, mid-face hyperplasia, depressed nasal bridge, prominent abdomen with exaggerated lumbar lordosis, genu varum, that are the bow legs, thoracolumbar kyphosis in infants. However, their intelligence will be normal and vitals are usually normal, but however, you should monitor for signs of respiratory distress or apnea in infants. Systemic examination in neurological system, you should assess for hypotonia or signs of cervicomedullary compression. Check for otitis media hearing assessment and respiratory system observed from signs of obstructive sleep apnea. Spine, look for gibbous or kyphosis in musculoskeletal system, joint laxity or limb deformities. So the differential diagnosis to consider include hypochondroplasia, which is a milder form, thanotropic dysplasia, thanatophoric dysplasia. Apologies for mispronunciation. It's a lethal variant. Pseudoachondroplasia, metaphyseal chondrodysplasia, multiple epiphyseal dysplasia, and other causes of disproportionate short stature. So the investigations diagnosed based on the clinical features along with radiological findings, but It is confirmed by molecular genetic testing. So X-rays of the limb and spines shows rhizomelic shortening. There will be square ilia, narrowing interpedicular distance in lumbar spine, metaphyseal flaring. Skull X-ray or CT scan if signs of increased ICP. See, this is the X-rays showing the short limb, and look at the bones and look at the humerus. This is a short humerus. Look at this is the bowing of the legs. See the iliac bones, femurs both. So genetic testing, FGR, gene mutation analysis, confirmatory test. Sleep study, polysomnography if sleep apnea is suspected, audiometry, hearing evaluation, MRI brain and spine if signs of neurological involvement. Treatment is specific, no cure. Management is supportive and multidisciplinary. Growth hormone not effective in most cases. Surgical, limb lengthening, controversial, usually avoided in children. In case of ENT, the ventilation tubes or grommets are inserted for chronic otitis media, and adenotonsillectomy can be performed for sleep apnea. Physiotherapy is required for hypotonia and motor delay. Occupational therapy and psychological support is very much required for the parents. So follow-up is regular monitoring of his growth and development, surveillance for spinal stenosis and hydrocephalus, ENT follow-up for hearing and otitis media. Dental follow-up is required due to crowded teeth. Psychological support for child and family. Orthopedic follow-up for limb and spinal issues. And then genetic counseling for family. However, antenatal diagnosis is present via ultrasound and is detectable in third trimester. There are short and long bones, macrocephaly and frontal bossing. Molecular diagnosis FGR, FGFR3 mutation tested by amniocentesis or chronic villus sampling if parental mutation is known. Antenatal diagnosis is difficult before 20 weeks unless there is a known family history. So this is the how the Cobb's angles are measured for kyphoscoliosis. See the lumbar lordosis in the small child. This is the brachydactyly and shorthand evident by the single crease. So thank you very much for your listening, and this was shortly about the achondroplasia, and this topic is important both theoretically as well as clinically. So I say that at least you share this video with three of your friends so that they should also understand and they can learn while walking, talking, or even during the driving. I pray that may Allah be our protector, helper, and guide. Allah Hafiz.